What's going on, everyone? It's Jeff Spencer here at Michigan Living. All right, it seems like that there is not just a Michigan issue, but a national issue, as there are a serious decline in the number of nurses for taking care of patients. Let's talk about this, shall we? Hello, everyone. All right, seems like that this is becoming a major issue all over the place. Now, it seems like that nurses are quitting, and states are seeking to train more. Under pressure from short-staffed hospitals and burned-out nurses, lawmakers in several states recently passed bills designated to expand nursing schools. For more than 2 years, COVID-19 pandemic has exposed both the importance of nurses and the strain on the workforce. Hospitals, long-term care centers, or even uh, kindergarten to 12 grade schools have been so short staffed in recent months that they've had to cancel procedures, delay moving patients into inpatient beds, or reduce other services. This legislative season, that sense of crisis is powered by bipartisan efforts to increase nurse training and licensing, really. The proposals will split somewhere along party lines, with Republican lawmakers in red states emphasizing reduced education regulations, and Democrats in blue states emphasizing funding increases. In other words, paying them more. Still, leaders in both parties agree on the need to get more nurses educated and helping patients. Well, yeah, I can understand that, but the nursing unions, etc., have all and hospitals have been talking about that there's going to be a shortage. This is nothing new. We knew this was going to be coming. As soon as the hospitals were required nurses and other staffers to become to have the shot in order to work for them, well, a bunch of people just didn't get the shots, have no interest in the shots, and then they were fired for not having the shot. And now we have a pandemic of nurses. Who knew this was going to happen? The proposals are split somewhat. Oh, yes, I already read that. All right, so Indiana, for example, needs to graduate 1,300 more nurses a year until 2030 to meet the state's health needs. Holy crap. Says Ethan Manning, a Republican. Governor Eric Holcomb last week signed a bill Manning sponsored that relaxes some nurse educational requirements. There was a nurse shortage in Indiana before COVID-19 hit. Manning pointed out, the pandemic, of course, only made it worse, so it's time to take some action. The new law drops limits on how fast 2 and 4 year nursing programs can grow, allows nursing schools to replace some required clinical hours with simulation hours. That's training using mannequins, technology, and role playing, and allows 2-year programs to hire more part-time faculty. Kentucky bill, also Republican sponsored, would lift limits on program growth and loosen the degree credentials required of nursing school faculty. Both the Kentucky and Indiana measures would also relax some nurse licensing issues. Meanwhile, New Mexico Governor Michael Lujan Grisham, a Democrat, has approved a budget that sets aside $15 million in grants that nursing programs can use to expand enrollments and $30 million to endow nursing faculty positions. All right, $15 million in grants for nursing programs. Okay, that could be good, but you still need to be able to get people to actually, use them. Washington State Democratic-controlled legislature has approved funds to expand public nursing programs by about 200 seats. About a 10% increase, according to Washington State Hospital Association. Improves simulation training and create a student loan assistance program for nursing school faculty. This year in particular, I've never had more impassioned pleas for nursing workforce policies from nursing directors and from hospitals. Yeah, because they feel the pressure the most. Bum, 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 bum. So, yeah, we have a situation where there's just not enough nurses and everyone's screaming that they need more nurses. Slater, a pharmacist, said she had heard from nurses who broke down into tears over the phone or called during the only 10-minute break they've had for hours. It broke my heart as a healthcare professional. Yeah. Nurses and so on are very underappreciated. I'm just telling you, they really are. Indiana's Manning this year also proposed a student loan relief fund for nurses and other types of providers who work in short-staffed areas of the state, among other criteria, but it went nowhere. Some of his colleagues were leery of creating a new government program, he said, and lawmakers and advocacy groups also disagreed over how to pay for it. Oh, yeah, I can understand that. The COVID-19 pandemic has put the healthcare system under such unusual strain that it's hard to say for sure how many new nurses the nation needs, academics, experts say. Now, the one thing that has always been interesting to me is where it even has it in there. I don't think that most people were worried that we were looking at a large shortage. Well, no kidding. This next one is a good one. The pandemic scrambled forecasts by increasing demand for nurses in key roles, such as intensive care units and emergency rooms, while simultaneously driving away nurses who are burned out, seeking higher pay, unable to find child care, or unwilling to get vaccinated. Remember, we just threw away all those nurses and stuff like that because they weren't vaccinated and they weren't going to get vaccinated. Kind of like cops and firemen and a bunch of other people. All right. Hospital associations and nursing groups in many states say local shortages are pressing, however, and they've been pushing lawmakers to respond. I don't know. I don't see how, of course, lawmakers are going to be able to do crap, to be honest. How do you expect in some of that lawmakers to do anything about people not wanting to become nurses or stay in the nursing field? Because they're getting burned out. You have requirements for vaccination. Long hours that and so you're just going to get burned out. Not exactly a huge, win. Not a good reason for people to want to be nurses. Later on top of that the pandemic, and many organizations seeking a 10 to 20% retirement and transitions from current nursing professions into other careers. So 10 to 20% of them are retiring and or transitioning, basically leaving nursing entirely and going in a completely different field. Yeah, how are lawmakers going to do anything about that? That's called working environment. Supposedly, one way to address the problem is simply to train more new nurses. Yes, that part would be true. Train new gullible, new people to be able to become nurses. But if the situation is still there, all they're going to do is burn out and go away as well. Nationwide nursing programs rejected more than 90,000 qualified applications last year because they didn't have space for any more students. That would be incredible. According to the American Association of Colleges of Nursing, a Washington, D.C. based group that blah, 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 colleges reject qualified applicants primarily because the schools don't have enough faculty. Okay. So then we're not really having a problem with people wanting to become nurses. We just can't train them fast enough to replace all of the issues that we already have now. Okay. So recruiting and training nursing faculty have long been a challenge. Nursing programs accreditors typically require faculty to have at least a master's degree. But such highly educated nurses can earn much more in clinical settings than they can teaching. Yeah, if you're going to be going on over and trying to become better or just have a higher degree, degrees don't mean that you're better. why would they bother to continue going into a faculty and teaching when they can be able to make a lot more money just staying in hospitals and using their degrees to go, hey, look, I got this, pay me more. To be in academia is a passion. In other words, to teach. To be a teacher really is more of a passion. This is what Deborah Walker, the executive director of the New Mexico Nurses Association, said. She said that in New Mexico, faculty members with graduate degrees can earn as little as $45,000 a year. In other words, you start out at $45,000 a year with a master's degree in nursing if you go into teaching. Oh yeah, there's a let's do that. While practicing nurses with less education, remember, because you don't need to have a master's, and so in order to be able to be a nurse, can earn generally about $75,000. Huge difference. About 8% of faculty jobs across the 935 nursing programs were vacant in the 2022 academic year. That's not that bad. Only 8%? That's not that bad. If it was a real issue, I would have expected a lot more than that. But, okay. But even at 8%, they're still saying that there's a problem. Nursing programs also require hands-on training, including supervised placements in hospitals, clinics, and other healthcare settings. Expanding a nursing program is not an easy task, says Donna Mayer, CEO of the Organization for Associate Degree Nursing, a San Diego-based group that advocates for community college nursing education. If I remember correctly, I even think that our Macomb Community College even has a pretty big nursing program as well. So if anything, if you are interested in becoming a nurse and going into helping people and stuff like that, go ahead and check out Macomb Community College in order to be able to see what their programs are. They're not just about cooking and creating chefs. It just goes on her and whatever. You can easily come in here and be able to read, a bunch of this and so that. So it's just that it's become a major issue. Now, miraculously, we now are all of a sudden having these issues with not having enough nurses. And especially because of that, the hospitals where we're still demanding more and more stuff happen and more out of their nurses. So they're just getting burned out and just retiring or just quitting entirely and leaving the industry itself, which puts even more strain on nurses. That's, that really right there, and so is going to be one of the biggest problems. Is I don't see how legislatures are really going to be solving this, because what can they do? Are they going to be able to go on over to hospitals and rah for the nurses to be able to stay and do your duty when they're getting burned out? Or, sure and so I could agree that there's one situation of being able to do this and to take care of this would be to have a lot more people. You could also get rid of the vaccine requirement so that those people who were forced out can come back into the jobs that they were forced away from. And then that would alleviate the issue, a lot of the issue immediately. But I highly doubt they're going to do that right now because they're a little slow in acting up with things. So is there going to be anything that's going to be easy about this? And, whatever, I don't think so. It's just going to be one of those things. But if you are interested in going into a nice, steady job where you can be able to help people and stuff like that, nursing would be a really nice area for you to be able to go to. It's in high demand. You could probably go in and you could probably demand quite a bit more salary than you normally would in a normal situation and get paid for that. But, it's just what it is. So this is what's going on. And if you want to be able to get into that, then it's would be a good idea. I just wanted to highlight this issue because it is something that's affecting everyone, especially the more the ones and stuff that are the more susceptible to who need help the most. All right. So if anything else, however, look into it, see what you think. If you have any questions, comments, whatever, hit the comments and let me know what you think. Like, share, and if nothing else is about it, I really appreciate you guys, and let me know. All right. Have a great one. All right. Thank you.